Namaste, I'm Dr. Anushree Muralidharan. Today I'm here with a topic: how to differentiate allergic rhinitis and common cold. You may be thinking why I'm talking about two clinical conditions simultaneously. Because in my short period of clinical experience, I have encountered many patients who are quite confused about these two conditions. These two clinical conditions are quite confusing because of the common symptoms it exhibits. I hope through this video I will be able to get rid of that confusion, at least in a few people. We Divineveda as a team are on a mission to create awareness about Ayurveda, yoga, diet and lifestyle through YouTube and other social media platforms like Instagram and Facebook. We take this opportunity to thank you for the immense love and support you have given Divineveda in our journey. As a token of gratitude from our side, we have started a giveaway of Rs 500 every week to one active subscriber. Last week's winner is Shrikant Kulkarni. Congratulations, Shrikant. This week also, we have selected one lucky person as the active subscriber of this week. The name of that lucky person will be announced at the end of this video. So please watch this video till the end to know who the lucky person is. In this video, I have included the subtopics: causative factors of common cold and allergic rhinitis, common symptoms of both, specific symptoms of both, season or time of attack, usually given medications, diagnostic criteria, complication, precaution to prevent both these conditions. So let's start the video. In this video, I will be discussing about two disease conditions which have almost very similar symptoms and how to differentiate these two conditions: allergic rhinitis and common cold. This knowledge or understanding about these two conditions are very important in order to give the most suitable treatment without confusion. Common cold, which we usually call as cold, is mostly due to the bacterial or viral infection, mostly viral infection. So it is called as viral rhinitis. When the virus gets inside the body starts defending against it, which brings the classical symptoms of common cold. Causes of common cold. There are many different viruses, and the viruses which cause common cold is contagious, which means it transmits from an infected person to a healthy person due to close contact, because of sharing things, or due to droplets. Whereas allergic rhinitis is a condition caused due to exaggerated immune response of our immune system. It is also called as hay fever. The underlying cause of this allergic manifestation is an allergen. Allergen is the substance which initiates allergic reaction in body. Exposure to dust, pollen, animal dander, pesticides and insecticides, smoke, excess sunlight exposure, paints and chemicals, perfumes and deodorants, etc. leads to a release of histamine, due to which the symptoms manifest. In common cold, the symptoms may last for 3 days to 14 days, whereas in allergic rhinitis, it may last for days to months. Now let's move on to the common symptoms of allergic rhinitis and common cold. These common symptoms are the cause of confusion and difficulty in diagnosis. The common symptoms are sneezing, runny nose or nasal discharge, sore throat, cough, etc. So, for easy differentiation of these two conditions, we should observe the specific symptoms which each of these conditions exhibits. Common cold will have few additional symptoms like fever, fatigue, headache, body pain, etc. Whereas in allergic rhinitis, the additional symptoms are itchy and watery eyes, skin rashes, wheezing, itching under palate, etc. Both allergic rhinitis and common cold may also lead to symptoms like loss of smell and taste temporarily, hoarseness of voice, repeated sinus infections, etc. Common cold is transmitted from one person to other due to close contact through droplets, cough or sneeze, or due to sharing utensils and clothes. whereas allergic rhinitis will not get transmitted from one person to other. Now let us see during which season or time common cold or allergic rhinitis attacks us. A person catches common cold during rainfall, snowfall, and sometimes during summer and spring. Whereas allergies mostly occur during spring months when pollen sheds and late spring when grass allergies are common. Common cold subsides within a week or so, whereas allergies last more than that and will occur very often and every time when exposed to allergic triggers. Now let's see the usually given medications for common cold and allergic rhinitis. Antibiotics, cough syrups, analgesics and decongestants are usually given for common cold. Whereas in allergic rhinitis, antihistamines, nasal corticosteroids in the form of nasal sprays or nasal drops, decongestants, etc. are given. Some doctors prescribe eye drops for itchy eyes. Moving on to diagnosis. Most of the symptoms will be common in the two conditions. So differentiating common cold and allergic rhinitis will be difficult. So proper diagnosis and giving suitable treatment will only give result. Otherwise, both these conditions leads to complications. Let us see what all investigations are done for diagnosis. Complete blood count is done in order to find out the number of white blood cells. Especially eosinophil count is examined to rule out allergic rhinitis. X-ray of head is done in order to find out any blockages. Rhinoscopy or nasal endoscopy is also done to rule out any structural deformities or blockage. Nasal swab is taken and culture is done in order to find out whether rhinitis is due to any bacteria or virus, and also to find out the strain of bacteria or virus. Some doctors do allergy test in order to find out the allergen. Complications. Both common cold and allergic rhinitis, when left untreated, will lead to bacterial or viral buildup in the sinuses and airways, cause middle ear infections, sinusitis, tonsillitis, bronchitis, pneumonia, etc. I hope you got some clarity about these two conditions and it will not be confusing anymore. I have done a separate video on how Ayurveda treats rhinitis or common cold, in which I have included the topics: Ayurvedic perspective of rhinitis, causative factors of rhinitis or pratishyaya, Ayurvedic diagnostic criteria, and Ayurvedic treatment. Link of the video is given in the subscription box below. Now it's time to announce the name of active subscriber of this week. For being the active subscriber, you just have to watch the videos and comment your suggestions and opinion in the comment box below, so that you can also win the exciting giveaways. The active subscriber of this week is Chidambar K. Congratulations, Mr. Chidambar. The winner should immediately contact us in our email ID contact@divineveda.com. So continue watching the videos of Divineveda and keep supporting us. And try to share the video with your relatives and friends.